This is my second career. My original plan was to be an athletic trainer, which I was for a few years. So I worked with college athletes and then decided that I wanted to take it a step further, and I went to physician assistant school. Orthopedics was a great fit for me after PA school, and I'm able to still help patients and help them lead as active a lifestyle as they can. I work in a non-operative setting, so I see patients and try to manage them and their pain. When I first see a patient, they come into my office and I evaluate their knees or their hips, whatever is bothering them, and I do a full workup. So I make sure we look at their body parts that are bothering them, and then we also look at any imaging that has been performed. I chat about their symptoms, their issues, why they're coming to see me, and then we discuss what I think the diagnoses are and then the next steps for treatment. And if there's any procedures that I can do that day, whether it's an injection, referring them off to physical therapy. I pride myself in really respecting patients and what they feel comfortable with their treatment. I call it my a la carte menu. I present options to patients and we decide together what are most appropriate. And I let the patient also kind of dictate our next steps. I call it a two-way street, so I don't necessarily force them to do things, but I do offer my opinion and help them in any way I can and facilitate any form of treatment that they are comfortable with and that I think is appropriate as well. My biggest rewards with my patients are seeing them maintain or get back to a healthy lifestyle. So to have them come to my office and say, hey, that injection you gave me, now I can go for a walk with my grandchildren, or now I can swim again in the pool because my body's feeling better. I always have the phrase with my patients that I hope I don't see them again in my office when they are feeling better. And I mean that with a lot of love, because I just don't want to see them coming back to see me long term if we can help prevent that. Surprisingly, when I'm outside of work, I do like to be active. I have two young boys. They are very into sports, so I not only love watching them play sports, but I try to stay as active as possible with them too. So we just put up a new basketball hoop, so we're shooting hoops in our driveway.